So we're going to start off with our keynote speaker. It's really kind of a privilege to have Andy with us, Professor Andy Haines from the London School of Hygiene and Tropical Medicine. He's going to talk to us about healthcare benefits of climate mitigation action. And looking at Andy's bio, it's extremely impressive. So, but he told me to keep it brief, so I will do. So he started as a family doctor. He was director of the London School of Hygiene and Tropical Medicine, knighted in 2005, member of the IPCC for the second and third assessment exercises and the fifth one on health, scientific advisory panel for WHO and the Lancet Commission. He's written loads and loads of papers on environmental change and health, and was awarded the Tyler Prize for Environmental Achievement in 2022. Very impressive. So, can we have a round of applause for Andy, please?
Well, look, thanks very much indeed for the kind introduction. It's great to be here. So what I'm going to do is to come at this from the climate change perspective, as you've heard. Let's see if that works. Yeah. So I'm going to take that as the kind of entry point from this, and I'm going to talk about the mitigation, the benefits of mitigation action, and mention also some of the trade-offs. We usually think, when we think about climate change, of course, we think of it as an impending crisis, which it is. But there are also opportunities within that crisis to really turn the tide and improve health and also address the environmental challenges. And that's what I want to focus on. So this is very familiar to many of you. It shows you where we are with greenhouse gas emissions. And the greenhouse gas emissions are driving the temperature increase. That's mainly carbon dioxide, but also short-lived climate pollutants like methane, which is an important climate-active pollutant. And you can see, I don't like the term warming, I prefer heating. Warming sounds far too reassuring. But the heating projections are around about 2.7 degrees centigrade, something like that, over the coming century, depending on the actions that are taken really over the next few years. And we are at a crunch point now where we need to act very quickly. And at the end, I'll just mention COP28 and what that might hold in store for us. The bottom line, the green line, is the 1.5 degree compatible, which is, of course, the prime target of the Paris Climate Agreement. And sadly, that's almost out of reach, very, very sadly indeed. It is still possible. We might get there after some sort of overshoot. But at the moment, I think we'll be lucky to keep the global average temperature below 2 degrees, which is certainly suboptimal, but a lot better than 2.7. And every 0.1 or 0.01 of a degree is worth fighting for, because we don't quite know where the tipping points might be, where you get these non-linear changes, collapse of the Antarctic ice sheet, and so on and so on. So we have to fight for every fraction of a degree that we can get. And you can see there's also a big gap between what countries say they want to do and what they actually do, the implementation gap, which is common, of course, to many policies. So the question is, how can we accelerate action towards to try to protect health from climate change? I won't say much about the health effects of climate change. This is an infographic which tries to summarize, which is quite a complex picture. And what you can see is that the increasing levels of CO2 and these short-lived climate pollutants that I've mentioned cause rising temperatures, rising sea levels, increasing extreme weather, and through a range of different demographic, socioeconomic, and other environmental factors, these modify the impacts of climate change on health. And although the whole planet is threatened, of course, in many cases it's those populations that have contributed least to greenhouse gas emissions that are the most vulnerable. So the top 1% of emitters, for example, are responsible for about 17% of greenhouse gas emissions, something of that order. And you can see the exposure pathways and the health outcomes at the bottom of the infographic. And I won't read them all out, but they kind of span right the way from the obvious extreme events and heat stress and so on, decreased labour productivity, increased heat-related mortality, wildfires, effects on air quality, increasing pollen possibly as well, water quality and quantity, and food undernutrition, the effects on vector-borne and other infectious diseases, and the effects on social factors. I've mentioned increased poverty because of heat, extreme heat exposure, displacement of populations, perhaps conflict as well. So complex patterns, but we already know that health is being impacted on by climate change. And one recent paper from colleagues at the London School and a big international team suggest that over a third of heat-related deaths over recent decades can be attributed to human-induced climate change. So it's not just due to natural fluctuations. But there are big gaps in the data, so very little data from Africa, much of Africa, and Asia, and so on. So probably underestimates. So what do we need to do to try and avert these negative and increasingly hazardous effects of climate change on human health? Well, there's two actions that we can take. One is we can adapt to the climate change that we can't prevent because climate change is already with us. It's about 1.2 degrees global average temperature, something of that order. And this year we've already seen the largest number of days over the 1.5 degree level that's on record. So it's going to be probably one of the hottest years on record. So we have to adapt as best we can. And that's not the focus of our discussions today, but we need to bear that in mind. So we need better flood protection, infrastructure upgrades, more sustainable food systems that are more resilient to climate change, health systems that can withstand climate shocks, and so on. But we're going to focus on mitigation, so the actions that we need to take to reduce emissions that cause climate change. So just to repeat, that's the carbon dioxide, that's the methane, also black carbon, which is a fine particle, of course, but also is climate active, and so when it's deposited on glaciers, for example, it also accelerates the melting of the ice, and that changes the albedo, the reflectance of the ice of the cryosphere, and so that further increases warming, heating, I should say. So there's an important distinction, I think, between pollution reduction that doesn't take into account mitigation and mitigation-driven pollution reduction, because there are tailpipe solutions. You know, you can put better filters on coal power stations. You can have better filters on diesel engines, as you know. But the problem with that is it doesn't deal with the underlying drivers, the underlying greenhouse gas emissions. Also, if you just filter out sulfates are actually cooling. So if you filter out sulfates without actually reducing greenhouse gas emissions, you can actually increase the heating on the atmosphere. So a very important distinction between the two. So when we're thinking about reducing air pollution, which of course is vital, it has to be done through actions that also help to mitigate climate change, in my view anyway. So what are the steps we need to take for a 1.5 degrees centigrade world? Well, this is the world, unfortunately, that's now almost out of reach. Perhaps we can retrieve it in the future, let's hope so. And you can see what needs to be done. And you can see also that we're not doing those. We need no new coal power plants, and by extrapolation, I think we can say no new coal mines, and our own government has given permission for a new coal mine to be opened, which is crazy. And we need to stop selling fossil fuel cars very quickly, but also adopt other transport strategies which are more inclusive. Not everyone will ever be able to afford an electric vehicle, so we need better public transport, active travel. I'll mention that in a minute. New buildings need to be zero emissions, and as we know in this country, we haven't really implemented the legislation that would really promote that, and so on. You can see the kind of panoply of actions that need to be taken that are not being taken. So one important, I think, conclusion, though, is that maybe this drive for improved air quality could also accelerate progress towards a net zero tipping point. And we often think of tipping points as negative tipping points in the climate system that can drive us further into trouble, like when the Amazon is now a net source of greenhouse gas emissions rather than being a sink, and the Antarctic ice sheet, and so on. But there may also be positive tipping points, which can accelerate progress towards a kind of net zero economy that most of us, everyone I guess in this room, would like to see. So as you know, the air quality guidelines, the WHO air quality guideline levels are lower than 15 years ago, and that reflects the growing awareness that even low levels of air pollutants have a negative impact on health, and the relationship at low levels may even be supralinear, so you get very big improvements in health with reductions in air pollution at low levels. And you can see the difference between the 2005 and 2021 long-term air quality guideline levels by WHO, reflecting this emerging, now I think fairly well-established evidence. You can also see on the right side of the slide that there is indeed a growth in clean energy. And now the investment in that clean energy has actually exceeded the investment in fossil fuels. But you can see that we're still actually investing nearly about $1 trillion a year in fossil fuels at a time when we need to be getting out of fossil fuels. So we're still investing far too much in fossil fuels. Although renewable energy is increasing, it's still not increasing at a rapid enough rate. And as you can see, also the investment in fossil fuels has actually increased since 2020. So that's a real setback. And we're seeing in the last few days fossil fuel majors like Exxon and so on confirming that they are solidly committed to expanding fossil fuels, and they see fossil fuels being burnt for the indefinite future. And of course, as we now know, Exxon has known about climate change since the 1970s, thanks to the excellent scientists that they had internally, and they chose to ignore that. So what about the benefits of moving towards a net zero economy? Well, the obvious one is when we stop burning fossil fuels, that reduces air pollution. This is an estimate that we did, well, actually led by my colleagues actually at the Max Planck Institute in Mainz in Germany, using their atmospheric chemistry model, estimating that fossil fuel burning leads to about 3.6 million deaths annually from ambient air pollution. And there are different estimates, some lower, some higher than that. And these estimates actually are being revised at the moment, and we hope to publish new estimates within hopefully 5 or 6 weeks, something like that, which will show an even larger number, by the way. And where do those deaths occur? Well, you can see on the map, a lot of them in China, India, across Europe, North America, less so in Africa because they don't burn as many fossil fuels, of course, less so in Latin America, but still quite a lot around, say, Sao Paulo in the south of Brazil. So big potential benefits. And the other important thing to say about them is that these are relatively near-term benefits. So when we prevent dangerous climate change, that obviously is beneficial to human health, but those effects will roll out over decades, centuries, maybe millennia. But these are near-term benefits that can be experienced within years, decades. So really, I think, add to the case for rapid action. I've talked a lot about carbon dioxide is very important. Of course, it's the long-acting greenhouse gas, stays up in the atmosphere for 100 years or more, has a complex life cycle. And I've mentioned the importance of methane. So it is important to combine actions on the long-lived CO2, and nitrous oxide as well, with methane. Because that will bring us more rapid climate impacts, because methane only stays up in the atmosphere for 12 years or so. So if you could reduce the emissions quickly, you could actually reduce the heat loading in the atmosphere. And you can see where it comes from: agriculture, fossil fuel, waste, and a few from other sources as well. And it's been responsible for about 40% of the warming or the heating since the Industrial Revolution. It's 86 times more powerful than CO2 over a 20-year period. And of course, methane itself is not immediately destructive to human health, but it is a precursor of tropospheric ozone. And tropospheric ozone, of course, is an important pollutant. Some estimates suggest perhaps 1 million premature deaths a year annually around the world. And methane is a precursor responsible for perhaps half of these deaths, something of that order, and has an impact on respiratory diseases. And also, by the way, reduces crop yields as well. So it's responsible for up to 15% of annual crop losses. So cutting methane would benefit the climate, would benefit human health, would probably also benefit food production around the world as well. We also know, of course, NO2 is important. This is a study we did a few years ago, again led by our colleagues at the Max Planck, which looked at the incident cases of asthma in children and adolescents from ambient NO2 air pollution, estimating perhaps 3.5 million worldwide annually, about 14% of the total. And of course, NO2 is emitted through fossil fuel use in land transport, power generation, and household sources as well. And the map shows you that sort of red, purpley colour is where the large numbers of incident cases occur. So reducing those emissions will also benefit health in the near term. And by the way, can I just say it's great to see Rosamund Casey-Deborah here in the audience, because she's made such important contributions through Ella's Law and so on, drawing attention to the importance of NO2 and also building public support for reductions in air pollution. So congratulations, Rosamund. So what about the more detailed policies, the effects of net zero policies on air quality? And most of them will be beneficial, but of course there are always trade-offs in some policies. You can see, this is taken from the Royal Society report a couple of years ago, and you can see on the right there is the benefits, the better air quality from net zero action, and on the left is the potential poorer air quality, so potential trade-offs. And one to look at here is building energy efficiency, which is that one there. And one of the reasons for the potential, some of the negative effects there, is that if you seal up buildings, but you don't ventilate them properly, then you can actually increase exposure to household air pollution. So it depends how you actually construct these energy efficient buildings. And there are also potential, depending on the assumptions you make, carbon capture and storage could have modest beneficial effects, or modest negative effects as well. So overall, it wouldn't bring the same health benefits as moving towards, say, renewables. And of course, nuclear is controversial for other reasons, not so much air quality, but a whole host of other reasons I don't have time to go into at the moment. So you can see that they're broadly beneficial, but there may be some trade-offs as well, depending on how you, which policies and how you design them. And there may also be spillovers as well. So we can't be, I think, we must be cognizant of the potential for spillovers. So as we need more metals, other compounds for batteries, for example, lithium, cobalt. You can get spillover, and one example is cobalt mining in the DRC. About 20% of that is artisanal mining, sometimes involving children. And a lot of work's been going on to try to regulate that and make it safer and more equitable. But still, we can't be complacent there about the potential adverse effects. And of course, the employment transition is a very important one. I used to work many years ago as a young family doctor in a coal mining community, or an ex-coal mining community. So I've seen at first hand what happens when communities are kind of abandoned, when the coal mines are no longer deemed valuable, and communities are abandoned by governance. So we need to have a just transition, not just for different countries, but also for different occupational groups as well. The food system is an important, obviously massive contributor to human health. It also contributes to greenhouse gases as well, about 20 to 25%, depending on how you define the food system. A lot of that comes from methane, but some CO2 as well. And this is taken from the Eat Lancet Commission, which did an interesting report in 2019, where they looked at what would be the implications of reforming the world food system to actually provide a healthy, sustainable diet for the world population, and estimated that we might be able to reduce premature deaths by 10 to 11 million annually within a few decades. That was the planetary health diet, they called it, that they recommended. Very rich in plants, whole grain, carbohydrates, nuts and seeds, and small amounts of dairy and animal protein. That was controversial. Some people didn't like the bottom line, but I think it was broadly in the right direction. Obviously, you couldn't impose a single diet on the whole world population. It would have to be adapted and so on. But I think it was a very interesting and provocative analysis. And then a more recent paper by my colleague, led by my colleague Pauline Shielbeek at the London School, looked at the Eat Well guide recommendations for food and showed that compared with very low adherence to these dietary recommendations for more fruit and vegetables, less animal products and so on, this was associated with a 7% reduced risk of mortality from ischemic heart disease and so on, and 30% lower dietary greenhouse gas emissions. So that would probably be largely reduced methane, which would probably affect ozone as well, but they didn't calculate the impacts of that. And then, well, perhaps I should just say this slide actually is for another presentation, but I'll mention it anyway. So one of the challenges we're going to have in implementing these kind of dietary change in the UK is that the UK has increasingly imported fruit and vegetable from climate vulnerable countries. And this is just, again, led by Pauline, some work that we published a few years ago, which showed you that between the mid-80s, when we imported about 20% of our fruit and vegetables from climate vulnerable countries, we now import about a third, and it's probably more than that because there's more recent analysis that we need to do. So even countries like the UK, unless we get our food system policies better organised and regulated, may have problems in implementing some of these dietary changes. So the food system is still a big challenge. It is a big driver of biodiversity loss and climate change, and we really need to optimise these policies to benefit both health and the environment. Also, there are big opportunities in urban design as well, and increasingly we're understanding that green space is good for health. good for climate change adaptation because it reduces, for example, the heat loading, the urban heat island. But it also helps to be more resilient against flooding. And it probably also reduces the demand for air conditioning as well. So it may have a modest mitigation action as well as locking carbon in. And in fact, there's a paper just come out yesterday which also shows us the benefits of green space exposure in Wales. And it shows us the benefits for mental health of having access to green space. And this is just a summary of some of the evidence from our colleagues at IS Global in Barcelona. And in Barcelona, they've developed this concept of superblocks. So the idea of a superblock is that you combine, in this case, 9 city blocks into one big block. And that you prevent through traffic, so you're not allowed to drive through them, but you can walk and cycle and you can park your car if you need to. And then they put more vegetation and so on in these superblocks. And they've estimated that if they could scale this up to the city of Barcelona, it could bring tangible health benefits from reduced air pollution exposure, but also increased exposure to green space. Active and sustainable transport is another area where there are big health benefits and climate benefits too. And we and others have done a number of studies in cities as diverse as Delhi, Sao Paulo, London, and urban England and Wales, and shown that there could be benefits to the climate and to human health as well. But you can't just put into place a few cycle lanes. You don't get much benefit from that. You actually have to look at a much more comprehensive public transport strategy. So you have to make public transport accessible, affordable. You have to make walking and cycling safe, otherwise people won't use it. And as far as possible, of course, protect them from fossil fuel powered or powered vehicles in order to improve safety. And we also, in the bottom on the right there, I won't go into details, but a study we did some time ago looking at the benefits if we could get the whole of the population of urban England and Wales walking and cycling like the population of Copenhagen. So it was a kind of thought experiment about what that would do for human health. And what we found is that there would be big benefits for human health, and we also tried to cost them in terms of the annual expenditure to the NHS that could be averted annually by different health outcomes being prevented, and showed that there could be big benefits to the NHS from reduced diabetes, which of course is very much driven by physical inactivity and to some extent by air pollution, dementia, heart disease, stroke, and other diseases as well. And the benefits would accelerate over time, as you can see. So when we put all this together, there could be big public health benefits of ensuring that health is put at the centre of these climate policies. So climate policies, well, one of the aspects of those is what's called the NDCs. So the NDCs are the nationally determined contributions which each country files under the Paris Climate Agreement. And those NDCs give an idea of the commitments that climates make to reducing greenhouse gas emissions. And traditionally, health has not been included very much in these NDCs. That's slowly changing. And this study, led by Ian Hamilton from UCL and other colleagues, modelled the effects in 9 countries of ambitious NDCs that put health at the centre of these new climate policies to meet the Paris, at least the well below 2 degrees goal. And they suggested that millions of air pollution deaths, diet-related deaths, and physical inactivity-related deaths could be prevented by implementing policies across energy, transport, food systems, and so on. So big potential benefits. They vary, of course, according to the country, according to the local context, but they're substantial in all contexts. And we've done something rather similar for the UK, and this is led by my colleague James Milner, published earlier this year, where we looked at the Committee on Climate Change's two different scenarios. The 2 broad pathways, including the higher engagement pathway, and we found that about 2 million, an extra 2 million years of life could be achieved by 2050 by putting in place policies that would reduce greenhouse gas emissions but also benefit health. And moving towards the more highly engaged pathway would increase those benefits by about 25%, something of that order, through reduced air pollution, including reduced air pollution in houses, by the way, improved diets and physical activity. So that just gives you a clue that to show that even in the UK we can get substantial health benefits from implementing climate mitigation policies that put health at the centre. And then finally, housing itself, in some work that we're doing at the moment is reviewing the world literature on this, and we found one very interesting randomised trial in Australia, the Victorian Healthy Homes trial. They did a randomised trial of upgraded homes in Melbourne's West and the Goulburn Valley, where they randomly allocated these houses to be upgraded before winter or after winter. And they showed that there was a big benefit for those houses that were upgraded before winter. They had nearly $1,000 Australian dollars cost saving on fuel, 43 minutes per day less exposure to cold temperatures, and for every $1 Australian dollar saved in energy, 10 Australian dollars were saved in health costs. So really empirical evidence that having a healthier, low-emission houses can actually benefit human health as long as you design the interventions appropriately. So coming to the close now, let me just finish by talking very briefly about healthcare systems, because we're now realizing that healthcare systems are a major emitter. If they were a country, they would be the fifth biggest emitter on the planet. So this is a paradox, that healthcare systems are meant to obviously improve health, but they're also damaging the environment as they do so. If you look at the US, the emissions are nearer 9% of their total emissions, and the US healthcare system is particularly inefficient for a whole range of reasons. And now over 70 countries have committed to building health systems which can both withstand the impacts of climate change better, which are low carbon and sustainable. And what you find if you look at the greenhouse gas footprint of healthcare systems is that about 2/3 of that are Scope 3 emissions. So Scope 3 emissions are those that come from the supply chains. So there are emissions that are embedded in the pharmaceuticals, the medical equipment, the supplies that healthcare systems depend on. So in order to decarbonise the healthcare system, you need to work with your suppliers, as well as decarbonising, of course, the energy from that's required by hospitals, healthcare centres, transport systems, and so on. So a lot of work going on, and I think it's fair to say that NHS England is playing a leading role in driving some of that transformation. So in closing, let me just say that it's also important, I think, to have a positive vision of where you want to go, because there's a lot of negative talk about climate change, and indeed it is a very concerning and in some ways very frightening future because of the policy inertia and the lack of activity by governments and vast amounts of misinformation and disinformation. But there's a growing evidence that having a positive health and or environmental framing bolsters public support for climate policy, even amongst those who are unconcerned about climate change. So we need to, I think, have in mind that we can't just talk about doom and gloom. We actually need to give people a vision of a world, of a society in which they want to live, that actually produces higher quality living at a much lower environmental footprint than we have at the moment. I'll stop there. Thank you very much.